Well, it's hard to imagine. I started in August of 2020 in the middle of COVID, and that just seems like a thousand years ago, and nobody even thinks about it anymore. We're just on to the next, moment of crisis, I guess. Um, and I do think that there were lessons learned during COVID that certainly taught us how agile we can be and and we've tried to continue that as part of the work that we do, understanding that we had to do so much and change so much during such a period of time of such uncertainty. So now, as we sort of look back at those days, we think about how do we create that energy without the drama, I think is probably the biggest opportunity for us. Um, but I would also say that um, the focus on cost controls and really trying to think about how we are more efficient. And there is, everybody obviously is really struggling with finances and trying to think about how we become both efficient as well as trying to meet the very important needs of our community. I've been doing this for almost 40 years now, and I've been hearing about how everybody's going to be cared for at home and we don't need hospital beds anymore. But, I got 100 people holding in my ED that tell me very differently about what their needs are and how they're going to be cared for. And I think that we underestimate the level of complexity that comes from caring with people who have chronic illnesses. And so while it seems like a simple pneumonia or a simple whatever, when you've got COPD and everything else added in that bucket, it requires a tremendous amount of care, and people, can't do that on their own.